I'm Jen Waits. I'm a social worker at Fresenius at two clinics, the Trustful Clinic and the Midfield Clinic.
Can you tell me a little bit about what you believe the greatest need is with the patients, whether it's with daily living needs or transportation?
So it's a hard one to answer because I have patients who benefit from both of those. Mm-hmm. Greatest, I would say the daily living needs, just because I feel like more patients utilize that. And sometimes for the transportation, there can be like a little bit of a waiting list, or it comes at the end of the month versus right then when they have a need.
The patient's allotment resets every year, January 1. We get a lot of increased requests.
Sure.
There's an obvious reason for that, but do you think there's any other reasons as to why we get so many requests at the beginning of the year?
Sure. I think possibly some of it is because it's the cold weather. I have a lot of patients who go without air conditioner. So even though, my power bill is probably the highest in July, I have some patients who don't have air conditioner, so theirs isn't the highest in July. Some patients, that heat just makes their financial responsibilities that month just higher. I think also the holidays, they spend more money around that time, so their bills just, there's a greater need for assistance there.
Okay.
But also I do have the patients who January 1st, they know it's there and they are dying to use it. I mean, I have November patients asking me, okay, bring it in January 1st.
Okay.
So all of those things.
Is there one particular area that you see that patients need help with? Whether it's car repairs or utilities or medicine?
Utilities is the main thing, and I think that also is because it's the easiest one to use. So like I know some patients who, if they can get assistance with their power bill that month, that money is going to be spent somewhere else where another need for transportation or something like that. Okay. So even if it's a utility bill, it's still helping out in other areas of their life as well.
Sure.
I have had patients use it on medication and car repairs. Okay. So I've seen them be used in tons of ways, but I would say mostly it's utilities, the power bill or the gas bill. I have a patient who, it was last November, I believe, that she got some assistance from the Alabama Kidney Foundation for a purchase that she made at Lowe's to get a hot water heater. She had not had hot water in over a year.
Oh, wow.
And now she has it. So,
okay.
Yeah, I mean, I think we take that for granted.
Exactly.
She hasn't had it for a year, and now she does. So,
wow.
Yeah.
In reference to the 2025 executive order advancing American kidney health, how is Fresenius addressing the issue with the decrease in benefits, and what do you think the role of AKF should be?
There's education and awareness, the benefits of home dialysis and getting a transplant.